Hello, Professor Bell. My name is Alexandria Head. I'm doing my research article on immunization and Bell's palsy in children. I found this research article online at the American Journal of Epidemiology and found it very interesting. It was first published online in 2012. First off, Bell's palsy is an acute idiopathic paralysis of the facial nerve, which affects roughly 11 people per 100,000 people per year. The study was done because immunizations have been speculated on as a cause of Bell's palsy, in particular multiple case reports that have described Bell's palsy following immunization with influenza and hepatitis B virus vaccine, also known as HBV. However, few epidemiologic studies of the association between immunization and Bell's palsy have been published, let alone studies including children. To the author's knowledge, no population-based epidemiologic study of the association between immunization and Bell's palsy have been conducted exclusively among children. The author's specific aim was to examine the association between immunizations with intramuscular inactivated trivalent influenza vaccine, also known as TIV, the HPV vaccine, or any vaccine treated all vaccines combined regardless of type, and Bell's palsy among children using a novel case-centered analytic approach. The study was conducted within the population of Kaiser Permanente in Northern California region and was published by the Kaiser Permanente Northern California Health Services Institutional Review Board. For the first year prior to the study, all children aged 18 years or younger diagnosed with Bell's palsy were identified using International Classification of Diseases. The cases had to meet the following criteria. 1. A definite diagnosis of Bell's palsy in the chart. 2. Unilateral weakness of all facial muscles, including involvement of the forehead, eyelid, mouth, and cheek muscles. 3. Acute onset within 72 hours between initial signs and the maximum paralysis. And 4. No report of head trauma or ipsilateral audiologic disease within the 30 days prior to the diagnosis, and no history of cerebrovascular incident, audiologic surgery, brain tumor, sickle cell disease, Guillain-Barré syndrome, or other neurological signs such as weakness of an extremity, coordination abnormalities, or other reflex or strength abnormalities, or asymmetries. For each case, the observed immunization status during pre-specified risk intervals, which were 1 to 14 days, 1 to 28 days, and 29 to 56 days prior to the onset, was determined. These risk intervals were selected on the basis of the author's literature and their understanding of the pathophysiology of the disease. The researchers found that the results showed that immunizations with the TIV or HPV vaccine was not significantly associated with the onset of Bell's palsy during any other risk intervals, which were again 1 to 14 days, 1 to 28 days, or 29 to 56 days. In addition, immunization with any vaccine was not significantly associated with the occurrence of Bell's palsy during the risk intervals. The study does call for further research to be done. The number of cases who received the intranasal live inoculated influenza vaccine was too small to examine the association between the vaccine and the Bell's palsy. Investigating a potential association between the immunization and with the intranasal live inoculated influenza vaccine and Bell's palsy remains an important topic because the route of administration of the vaccine and the fact that it is administered directly through the nasal passage, and Bell's palsy causes paralysis of the 7th cranial nerve, which is the facial nerve. I chose this study to review because there's so much controversy between getting your child vaccinated or not and the possible harm of being vaccinated. I, however, do not believe that being vaccinated poses any risk and should be a mandatory practice nationwide. I also want to disclose that I even felt this way before reading this article. I find this article interesting, clearly written, and informative. To the researcher's knowledge, this study currently represents the largest population-based epidemiologic study that was associated with immunization and Bell's palsy in children. After reviewing this research article, I understand that immunizations play no role in Bell's palsy. However, I am interested to know if the intranasal live inoculated influenza vaccine can cause a major episode or a minor episode of Bell's palsy. Thank you so much. Bye-bye.